Health officials are warning about the largest outbreak of tuberculosis ever recorded in the United States.
Since the beginning of this year, there have been 67 symptomatic cases in the state of Kansas, split between two counties in the Kansas City suburbs. Health officials say that's on top of 79 so-called latent or inactive cases where someone tested positive for the disease but is not showing symptoms. Joining us now, NBC News medical analyst Dr. Vin Gupta. So, Dr. Gupta, just how rare is an outbreak like this? And walk us through how exactly tuberculosis spreads.
Well, it's very rare. This is arguably one of the worst outbreaks in history of what we're seeing in Kansas and the United States since we've been tracking from all the way back to 1950. In terms of how it spreads, this is a classic case. If somebody has pulmonary tuberculosis, we're talking coughing, even coughing up blood, night sweats, weight loss. Can be chronic for up to 3 weeks. So if that's you or if that's a loved one, that's when you want to get tested. But it can spread through droplets from an expectorated cough. So that's what we're worried about.
And we mentioned in the beginning, some people get the symptoms. Other people have these sort of latent cases. Explain that, where they don't feel anything?
Yeah, it's confusing. Patients of mine are confused by it. It's a concept where basically we're exposed to it. It's lying in a latent phase in our body. It's not causing symptoms. If you have latent TB, 1 in 3 people worldwide actually have latent TB. It doesn't cause any problems. You're not symptomatic. You're not contagious.
And I guess we usually don't even know.
We don't even know.
Right.
Exactly, because we're not testing for it. The concern is about 1 in 10 people with latent TB it becomes active in about 10% of people who do not get treated because they have an immunocompromising condition or something else happens.
And so, given the historic nature of this outbreak, how do we protect ourselves, and also how do we get tested?
Symptom awareness is critical. So if you've traveled, if you travel overseas, frankly, anywhere, and you have symptoms, chronic cough with weight loss or a fever, night sweats, any combination of those symptoms with a travel history, get seen immediately, get tested. If you live in a communal setting like a dorm, or if you're in a nursing home facility and you have those symptoms, that's important as well. That's a huge risk factor. So it's really about at-risk populations that we're worried about with concordant symptoms.
Yeah, we had on the screen that the general public is probably not at huge risk.
Absolutely. That's right, exactly. General public, low risk, historically low risk in the United States, but it's these pockets.
Dr. Vin Gupta, always great to have you. Thank you.
Thank you.
Well, we're taking care of business now. Google says it is making a major change to the maps America sees.
And things are heating up in the pickleball kitchen. Julia Borston joins us now with today's CNBC Money Minute. Hey, Julia.
Hi, Cadence and Clay. Well, Google is changing its maps to fall in line with 2 name changes ordered by President Trump. The tech giant says it will update the names of the Gulf of Mexico and Denali to the Gulf of America and Mount McKinley. Google says the changes will take effect when the government updates its official listings for the Gulf and the mountain. More than 100 cases of smoked salmon sold at Costco stores in Florida have been recalled over a possible listeria contamination. The FDA said the Kirkland Signature brand smoked salmon manufactured from the Acme Smoked Fish Corporation was upgraded to the highest risk level for